Hello, this is Bradley Graw, one of the orthopedic surgeons at the Palo Alto Medical Foundation in Palo Alto. Welcome to this video on early rehabilitation and basic exercises for hip strength. I am a lifelong athlete, former collegiate lacrosse player at Yale, and I've been an orthopedic surgeon for more than 10 years. My practice focuses on hip and knee reconstructive surgery, and these exercises can be very relevant should you be recovering from a hip injury or potentially from hip reconstructive surgery. Here are the series of exercises that I recommend for early strengthening if you have a hip injury or after hip surgery. First is a standing abductor exercise for gluteal strengthening. Then clamshell exercises and gluteal bridges performed sitting on the ground. I then recommend that you refer to a stretching program, as I have in a separate video on this series, as well as a core strengthening program. Stretching and core strengthening both are important to rehabilitating after hip surgery or injury. Lastly, in this series, I recommend two dynamic exercises performed walking over a short distance, both a lateral shuffle exercise and a cowboy walk, which will both be described for you. Neither the stretching program nor core strengthening program is included in this video, but please go to my YouTube channel where you have accessed this video and you can find both of these programs separately. The gluteal muscles are the core muscles that need to be strengthened if you have a hip injury. On the top right hand of the screen here, you will see the gluteus maximus. Deep to this is the gluteus medius. The latter helps stabilize the pelvis so that it does not drop. There's also a smaller gluteus muscle that is deeper. These exercises will also help strengthen the hamstrings and the other lateral aspects of the hip, including the tensor fascia lata and the hip flexor. All of these are important for good hip stability. It's first very important to understand that if you have had hip replacement surgery or reconstructive surgery, wait until you have been cleared by Dr. Graw or one of his team members. This is usually around 6 weeks after that intervention. If you are in the early phases of rehabilitation after hip surgery or with a hip injury, standing abductor strength exercises and clamshell exercises performed while sitting are both a good place to start. Doing these 2 to 4 times a day is a great way to stabilize the hip and help reduce pain over time. Walking is also a great, safe exercise after hip surgery or with a hip injury. But again, do follow specific guidelines if you are within 6 weeks after any surgery. And don't hesitate to clarify on these exercises or with any program with Dr. Graw and his team. Let's get into the standing hip abductor strengthening exercise. The goal here is to strengthen the gluteal muscles, primarily the gluteus medius. The way to do this when standing is to stabilize yourself with one hand, hold the leg out to the side. This is the hip abducted position for approximately 3 seconds. Relax, bring the leg back to the midline, and then repeat. Ideally, you should perform 10 repetitions and approximately 2 sets. A related exercise performed on the ground is the clamshell hip strengthening exercise. The reason this is performed on the ground is because it does add a bit of stability while you're rehabilitating from an injury or surgery. It also adds gravity to the equation, making things somewhat more difficult. An additional level of difficulty is added by using a TheraBand, as I'm showing here. In either case, you are bringing the leg away from the midline. You should be feeling a burning and contracture about your gluteal muscles. You hold for 3 seconds and then bring the leg back to the midline. Physical therapists may show you some nuance in terms of strengthening the different aspects of the glutes using this basic exercise. The hip bridge is a very good exercise to strengthen the gluteus maximus as well as your hamstrings. Laying on your back with your knees flexed to a bit more than 90 degrees, feet flat on the floor, you bring your hips up towards the sky, hold for 3 seconds, and then relax. A goal is to perform this 10 repetitions, again approximately 2 sets. You might intersperse core strengthening or stretching at this point before performing the lateral shuffle exercise. This is a dynamic hip strengthening exercise, again good for strengthening the glutes, but also requiring core stability. Notice how I shuffle side to side in a controlled fashion. Generally, I recommend stepping 6 to 8 steps in one direction and then back towards where you came. You can also use a TheraBand for this exercise to make things more difficult. 2 sets is a good amount to feel a good burn in those muscles that we are trying to strengthen, and focus on a good form such that your knee does not come out over your toe and you have good stability to your low back. A related exercise is the cowboy walk, also a dynamic exercise for hip strengthening that has more attention to the gluteus maximus and the hip flexor in addition to the gluteus medius on the outside of the hip. Here, you position yourself like a cowboy, kind of like a gunslinger, swinging one leg around and then the other, generally using a TheraBand to get the best effect. Same distance traveled as for the lateral shuffle exercise. To recap, for early rehabilitation after hip injury or surgery, think about these key exercises: standing abductor strengthening, clamshell exercises and gluteal bridges while seated, stretching and core strength, and then more advanced exercises being the lateral shuffle and the cowboy walk. I cannot emphasize enough getting official clearance from Dr. Graw or his team if you have recently had hip replacement surgery. Generally, this is at 6 weeks. Remember that the standing abductor strength and clamshell exercises are good starting points if you do have a hip injury or have been cleared by Dr. Graw, and to perform multiple series per day to get the best effect. Don't hesitate to clarify any of these issues with Dr. Graw. Thank you very much for watching this video. We look forward to seeing you in clinic should you need our assistance.